Hi, I'm Professor Alex Blazinski. I'm the director of the Gambling Treatment Clinic here at the University of Sydney. This clinic is committed to helping people who experience excessive gambling problems, strong urges to gamble and difficulty controlling their behaviour. Look, I would strongly encourage you to take that first courageous step of contacting a clinician here at the Gambling Treatment Clinic, because if you do so, you'll find that the treatment interventions will make a major and significant impact on the quality of your life, not only for yourself, but for your family and others within your life.
So gambling for a long time has been a big part of Australian culture, and for many it can be a really fun and exciting way to pass time and to spend money, but for others it can become really a huge obsession. So when people are spending more time and money than they can afford gambling, it can have huge impacts on their lives in all sorts of areas. It can create massive amounts of financial burden, can cause huge strain on relationships, can cause legal problems, personal problems, a lot of depression, anxiety, emotional difficulties. So it does have huge impacts on people's lives, and often people are hesitant to get help because they are often ashamed and embarrassed about their gambling. So it can take people a while before they feel comfortable sort of seeking help.
Okay, the Gambling Treatment Clinic is a unique service. It's the first university-based treatment service. We're also a service that completely dedicated to just treating problem gambling. So we've been around for a number of years, since 1999.
We're a free service and we're here, happy to help and offer an appointment to anyone. You just need to call us or email us. Typically therapy lasts between 8 to 10 sessions with 1 hour per week, but there are times where that may be shorter or longer, and that's okay too. We're trying to deliver an effective treatment but also an efficient treatment.
Okay, so our services are available from Darlington, Lidcombe and Campbelltown, and we also offer outreach to Parramatta, Tamworth and Narellan. We have normal office hours of Monday to Friday 9 to 5, but we can be flexible with those times.
Look, sometimes people that contact the Gambling Treatment Clinic have other difficulties in their life, and quite often they wonder whether that's causing the gambling or what the relationship is with their gambling. And what our staff are actually trained to do is help them understand what the relationship is between gambling and the other difficulties that they have. Sometimes there is a relationship between the problems and sometimes there's not, which is occasionally surprising to people. But what our staff do is, because we're specialising in treating gambling, and that's basically what we do extremely well, we try and focus on that at the Gambling Treatment Clinic, and when people need to see other professionals for their other difficulties, we'll help them organise that.
So we at the Gambling Treatment Clinic offer treatment for problem gamblers, treatments that we know are effective, that we know work. So if you're having problems with gambling and feeling like you need some assistance, please contact us.
But we're now at the stage where we think that we've possibly got the best treatment that we've ever had. The name of that treatment is cognitive therapy, or pure cognitive therapy, and it's actually a different treatment to the one that's commonly used in the sector, which is called cognitive behavioural therapy, or CBT for short.
So in relation to our behaviours, when we're referring to things like thoughts or beliefs or desires, these things, or the collection of these things, are referred to as cognitions. And when we're talking about cognitive therapy, we're essentially talking about how these things motivate our behavior. So when it comes to gambling, here's what we know, that there's individuals who hold certain types of beliefs about the probabilities of winning. Now the problem with that is twofold. Number one, usually the individual is not aware of the fact that they hold these certain beliefs about the probability of winning. And number two, they're not only unaware of the fact that they hold the beliefs, but they're unaware of the fact that those beliefs happen to be inaccurate or misguided. So cognitive therapy begins with trying to unveil what erroneous beliefs the individual holds without necessarily having awareness that they hold those beliefs to begin with, and following from that, what corrections to those erroneous beliefs need to occur so that the individual is able to make better choices in the future.
If you'd like any further information about what you've seen in this video, or you'd like to make an appointment, just give us a call here at the clinic and one of the counsellors would be happy to help you.